I'm Dr. Cherryl Christensen. I am an occupational medicine physician who began my career many years ago with some time with the United States Navy, working at Norfolk Naval Shipyard, then at the University of Cincinnati College of Medicine in the field of occupational environmental medicine at the Kettering Lab, and then for the next 27 years with the Procter Gamble Corporation, with my career culminating in my role as their global medical director. For companies that are medium to small size to think about this, because many times they don't have the internal medical resources that larger companies have. So they have to be a little more creative about how they're going to be able to make such a thing like this work. If you do have on-site clinics, that's great, because you can maximize now what you're doing there and put this in as an additional resource to the company. But if you don't, then you have to think a little more carefully and strategically about how you're going to make this happen. Are you going to then increase your internal resources? Are you going to think about contracting it out? How are you going to get after this? Because health and healthcare costs, not only in the United States, but globally, particularly now in the midst of the pandemic, not only physical, but mental capabilities are being stretched. So I actually think it's more critical now than ever to begin to think about this and not be totally intimidated by it as being too hard, because there are ways to get after it. I think today there's been a lot of good work done in the area of a culture of health and how to develop one, thankfully. And companies that are interested in doing this, or organizations today, don't have to go out and spend the years and years that we spent trying to figure this whole thing out. There are ways now, and I think HealthNEXT has probably got the lead approach and tools to deliver this, to help a company deliver this when they're ready, that actually brings together the key learnings of the thought leaders of what it takes to get a successful culture of health in place in your organization. I am not saying it's easy. I'm saying it takes commitment, it takes passion, but I think from my experience, it can be one of the most wonderful things that can happen for a company and for the employees in the company. Healthy business, healthy people. That's what it's all about.